Did you know that some of the medications you rely on daily might be silently damaging your kidneys? It's shocking, but true. While these drugs are often necessary for treating pain, infections, and chronic conditions, they can have unintended consequences on your kidney health. Here's the thing. Your kidneys work hard to filter out toxins and maintain balance in your body. But certain medications can make that job nearly impossible, pushing them towards serious damage, even failure. If you've ever taken common pain relievers, antibiotics, or mood stabilizers, it's time to pay attention. The very thing you count on for relief could be wreaking havoc on your kidneys without you even realizing it. What if you could avoid these risks and protect one of the most vital organs in your body? Today, I'm going to show you the 6 most dangerous medications to watch out for and how they could be undermining your kidney health right now. Trust me, number 3 is one you won't expect. Antibiotics. Antibiotics are lifesavers when it comes to fighting infections, but did you know they can also be tough on your kidneys? Take polymyxins and aminoglycosides, for example. These antibiotics are known to damage kidney cell membranes. When they build up in the kidney cells, it disrupts the kidney's ability to filter properly. The result? An increased risk of kidney damage. Even common antibiotics can have this effect if not taken under the right guidance. The problem gets worse when people misuse antibiotics. Often, antibiotics are taken for conditions where they aren't even necessary, like viral infections. This not only contributes to antibiotic resistance, but also raises the chances of kidney issues. You've probably heard of someone who took antibiotics for a cold. This is a perfect example of how misuse can be harmful. Always consult a healthcare provider before jumping to antibiotics. If antibiotics are necessary, remember that hydration is your kidney's best friend. Drinking plenty of water can help flush out the medication and reduce its accumulation in the kidneys. This simple habit can go a long way in minimizing damage, especially when you're taking strong antibiotics. But if you think that's all you need to know, wait till you hear about another common culprit, NSAIDs. Nonsteroidal anti-inflammatory drugs. NSAIDs like ibuprofen and aspirin are household names when it comes to pain relief. But behind the scenes, these common meds might be slowly impacting your kidneys. How? Well, they reduce blood flow to the kidneys and cause inflammation over time. It's a double-edged sword. The more you use them without proper care, the higher the risk of developing acute kidney injury, AKI, especially if you're not staying hydrated. One big problem with NSAIDs is that people often don't think twice before popping them. A headache? Reach for the ibuprofen. Aching muscles? Here comes aspirin. But using these medications consistently without giving your kidneys a break can put them under unnecessary stress. Chronic NSAID use is particularly risky for older adults, whose kidney function may already be declining naturally. So what can you do instead? If you're relying on NSAIDs frequently, consider speaking with a healthcare provider about alternatives for pain management. And again, don't underestimate the power of water. Keeping yourself hydrated can mitigate some of the stress these drugs place on your kidneys. But NSAIDs are just one piece of the puzzle. Let's move on to diuretics, another common medication that requires balance. Diuretics, often known as water pills, are frequently prescribed to manage high blood pressure and fluid retention, but they come with their own set of risks. While they help your body get rid of excess fluid by increasing urine production, they can also lead to dehydration if not carefully monitored. Dehydration is a major risk factor for kidney damage because it forces your kidneys to work harder to filter out waste with less fluid to assist in the process. People taking diuretics often notice increased trips to the bathroom, which may seem like a good thing for reducing bloating or lowering blood pressure. However, if the body becomes too dehydrated, it can result in electrolyte imbalances, which directly affect kidney function. It's all about balance. Using diuretics to improve health, but not to the point of overloading your kidneys. This is why regular check-ins with a doctor are key when on diuretic therapy. To offset these risks, it's essential to maintain proper hydration. Drinking water in moderation and monitoring how your body feels can help prevent complications. If you ever feel lightheaded, fatigued, or experience dry skin while on diuretics, it could be a sign that your kidneys are struggling to keep up. And now, let's talk about the hidden dangers of antiviral drugs, particularly in their impact on kidney health. Antiviral drugs, antiviral medications like acyclovir and remdesivir, are crucial when battling severe viral infections, but they can also harm your kidneys if not carefully monitored. These drugs can form crystals that block kidney tubules, hindering the kidney's natural filtration process. On top of that, they can cause kidney cell injury, leading to conditions like acute kidney injury, AKI, especially in patients who are already vulnerable due to other health conditions. For those taking antivirals, the dosage and duration of use are crucial factors in preventing kidney damage. If these drugs build up in the body, the risk of harming the kidneys increases. That's why it's important for healthcare providers to adjust the dosage based on kidney function. Patients often don't realize that their kidneys might be taking the brunt of the treatment. It's essential to have regular kidney function tests if you're on these medications for an extended period. An easy tip to reduce these risks? Drink plenty of fluids to help the kidneys flush out the medication more effectively. But always check with your doctor about the right fluid intake, especially if you have underlying health conditions. The kidneys work hard during antiviral treatment, but they aren't the only organ at risk. Wait until you learn about the impact of chemotherapy drugs on kidney health. Chemotherapy drugs. Chemotherapy, while life-saving for many cancer patients, can be extremely harsh on the kidneys. Medications like cisplatin and methotrexate, commonly used in chemotherapy, are known to be toxic to kidney cells. These drugs target cancer cells, but they can also damage the kidney's delicate filtering system, leading to conditions like acute kidney injury, AKI, or even chronic kidney disease, CKD, if the damage is prolonged. The kidneys play a crucial role in filtering out chemotherapy drugs from the bloodstream. However, when the kidneys are overwhelmed, they struggle to clear the toxins, causing them to build up in the body. This can lead to further complications, such as difficulty urinating or a dangerous increase in waste products in the blood. It's why kidney function is closely monitored during cancer treatment, with adjustments often needed to prevent permanent damage. Patients undergoing chemotherapy should stay well hydrated to help their kidneys flush out the excess toxins. Additionally, doctors often prescribe protective medications to safeguard kidney health during treatment. But even with these precautions, chemo can take a toll. Now, let's dive into another common medication that poses a significant risk to the kidneys: lithium, widely used in the treatment of bipolar disorder. Lithium, commonly prescribed for bipolar disorder, has been a cornerstone in mental health treatment for decades. However, long-term use of lithium can cause serious kidney damage. It's known to lead to nephrogenic diabetes insipidus, a condition where the kidneys lose their ability to concentrate urine. This results in excessive thirst and frequent urination, which, over time, can put immense strain on the kidneys, potentially leading to chronic kidney disease, CKD. The challenge with lithium is its narrow therapeutic window, meaning the dosage must be carefully managed to prevent toxicity. Even slight variations in blood levels can be harmful. This is why individuals on lithium are frequently required to have their kidney function tested. The drug's long-term effects may not be immediately obvious, but without proper monitoring, the risk of kidney damage grows significantly. For those on lithium, staying hydrated and keeping up with regular checkups are key. Doctors may adjust dosages or suggest alternative treatments if kidney function begins to decline. Lithium's potential effects on the kidneys make it a tricky medication, but it's certainly not the only one. With that, let's conclude this discussion on the importance of monitoring medications for kidney health. Now that you know about the hidden dangers of these medications, what steps will you take to protect your kidneys? Think about it. Your kidneys play a vital role in keeping your body balanced and healthy. Ignoring the risks of medications like NSAIDs, antibiotics, or lithium could lead to irreversible damage. So, what are you going to do to ensure your kidneys stay healthy? Are you going to have that conversation with your doctor? Maybe start monitoring your medication intake more closely? If you've learned something new today, it's time to act. Your health is too important to leave to chance. And remember, protecting your kidneys doesn't have to be complicated. Sometimes, it's just about making smarter choices. If you want to keep learning how to safeguard your body, hit that subscribe button and ring the bell. Stay informed, stay proactive, and let's keep your kidneys working as they should.